The part of the guava most people ignore may be the part your aging body has been asking for. Not the sweet fruit, not the juice, the leaf. Because when guava leaves sit in hot water, they release plant compounds that may support three problems many people over 50 begin to feel in their body long before they talk about them out loud. The stiff first steps when you get out of bed, the skin that looks drier, thinner, or more tired than you feel inside, and the blood sugar swings that leave you sleepy after meals, even when you thought you ate normally. That is why this leaf deserves your attention, not because it is a miracle, not because it replaces your doctor, because it may give your body a simple daily support at the exact place where aging often starts to push back. My name is Dr. William, and this is Senior Health Sessions, and I want you to hear this clearly before we go deeper. Guava leaf tea is not a cure. It is not medication. It is not something you use instead of a treatment plan. But for many seniors, the most powerful health changes are not dramatic. They are quiet. They happen in the kitchen. They happen after breakfast. They happen in the evening when you choose what goes into your cup. And sometimes, one small habit becomes a way of telling your body, I am paying attention again. Because after midlife, your body changes in ways that can feel confusing. You may not wake up one morning feeling old. It happens in small moments. You stand from a chair and your knees need a few seconds to cooperate. You climb the stairs and notice your legs feel heavier than last year. You finish lunch and suddenly want to close your eyes. You look in the mirror and your skin seems less alive, even on a good day. Most people separate these problems. They think the joints are one issue, the skin is another, the blood sugar number is another. But inside the body, these problems can overlap. They can all be touched by the same deeper pattern: too much internal stress. Not just stress in your mind, stress in your tissues, stress after meals, stress from inflammation that stays active too long, stress from the everyday wear and tear your body has to handle with fewer reserves than it had at 30 or 40. And that is where guava leaf tea becomes interesting. A guava leaf does not look impressive. It does not look like something that belongs in a health routine, but leaves are the part of a plant that spend their whole life defending themselves. They face heat, sun, insects, weather, and damage, so they contain natural protective compounds. One group is called polyphenols. That simply means protective compounds found in plants. You do not need to remember the word. Just think of them as tiny plant shields. When dried guava leaves are steeped in hot water, some of those plant compounds move into the tea, and guava leaf has been studied for several areas that matter deeply as you age: blood sugar response, inflammation, and antioxidant activity. That last word, antioxidant, just means helping protect cells from everyday wear and tear. So we are not talking about a magic trick. We are talking about support. Support is the honest word. Support for steadier after-meal response. Support for a calmer internal environment. Support for the kind of daily repair your skin, joints, and energy depend on. And that support touches more of your day than you might expect, starting with the meal you're probably eating without thinking twice about it. Now, let's start with blood sugar, because this is where many older adults first feel something is different. You eat a meal that used to be normal for you: toast, rice, potatoes, pasta, a sandwich, a small dessert. And then, an hour later, your energy drops. Your eyes get heavy. Your thinking slows down. You feel like your body has pulled the plug. Have you ever finished a meal and thought, why am I so tired from just eating? That question matters. When you eat starchy or sweet foods, your digestive system breaks them down into sugar that moves into your bloodstream. When you were younger, your body may have handled that rise more smoothly. As you get older, the response can become slower, bumpier, and less forgiving. Picture a small neighborhood street during a sudden downpour. A little rain is no problem. The drains can handle it. But when too much water rushes in at once, the street floods. Cars slow down. Everything backs up. That is a simple way to think about a sharp rise in blood sugar after a meal. Your body is trying to move the sugar where it belongs, but the rush can strain the system. Guava leaf compounds have been studied because they appear to interact with some of the digestive helpers that break starches down. Those helpers are called enzymes. In plain English, guava leaf may help slow how quickly certain starches are broken down, which may support a steadier blood sugar response after meals. That does not mean you can drink tea and eat anything you want. It does not mean the tea cancels out cake, soda, or a plate full of white bread. It means the tea may be most useful when it is paired with wiser choices. More protein, more fiber, fewer big sugar swings, a short walk after eating, and an unsweetened drink that does not add more sugar to the problem. Here is the one safety point I want you to keep with you. If you take diabetes medicine, blood pressure medicine, blood thinners, or you have kidney or liver problems, talk with your health professional before making guava leaf tea a daily habit, and never change medication because of a tea. That matters because natural does not mean harmless. A leaf can be gentle and still be active in the body. Now think about your own meals. Which meal makes you feel the heaviest afterward? Breakfast? Lunch? Dinner? Or is it a certain food like bread, rice, cereal, or something sweet at night? That answer is useful because your body often gives clues before your lab work does. A sleepy crash after meals is a clue. A foggy head is a clue. Cravings 2 hours after eating can be a clue. And if you already check your blood sugar at home, you may see that one meal behaves very differently from another. This is why timing matters. Not in a rigid way, in a practical way. You learn your own pattern. You stop guessing. You start reading your own body like it's been trying to talk to you the whole time. And guava leaf tea fits that kind of routine because it is simple. You can make it in the kitchen. You can drink it without sugar. You can try it around the meal that affects you most. You can watch how your body responds. But blood sugar is only the first part of the story. The second part is your joints. And I want to be careful here. 1 cup of tea does not rebuild cartilage. It does not erase arthritis. It does not replace movement, strength, or medical care. But it may still matter because your joints are affected by the environment inside your body. As you age, inflammation can become like a smoke signal that never fully clears. A little smoke after an injury is useful. It tells the body to send help. But when the smoke lingers day after day, it begins to irritate the whole room. That is how ongoing internal irritation can feel in an aging body. Your hands feel tight when you wake up. Your knees need time before they trust your full weight. Your shoulders move, but not freely. Your feet feel tender during those first steps to the bathroom. Have you ever noticed that the first 5 minutes of your morning feel older than the rest of your day? That is not just an inconvenience. That is your body speaking. It may be telling you that your tissues need more support, more movement, better recovery, or less internal strain. Guava leaf contains plant compounds that have been studied for antioxidant and anti-inflammatory activity. Again, keep the language honest. This is not a painkiller in tea form. It is not a treatment for joint disease. It is a gentle habit that may support a calmer internal setting. And for seniors, that can be meaningful. Because your joints do not live separate from the rest of you, they are influenced by sleep, blood sugar, hydration, protein, walking, body weight, stress, and what you drink instead of sweet beverages. That is why a warm, unsweetened tea can matter beyond the cup itself. It can replace something that spikes you. It can slow down your morning. It can become the moment you stretch your fingers, roll your shoulders, or take your first short walk of the day. The tea is not the whole answer. It is the doorway into a better routine. And that is where many people get health habits wrong. They ask, will this fix my joints? A better question is, can this remove one layer of strain from my body? That is the kind of question that helps you age with intelligence. So tell me this, do you feel more stiffness when you first wake up, or more soreness later in the day? Those are different patterns. Morning stiffness often points to overnight tightness and internal irritation. Later day soreness may be more connected to activity, posture, muscle weakness, or overuse. When you know your pattern, you stop treating your body like a mystery. Now let's bring in the third part of the title, the one you already caught a glimpse of earlier, standing in front of your own mirror. Your skin. Skin is where many people first see aging, but it is rarely only a skin problem. Your skin is connected to what is happening underneath. When blood sugar swings often, when sleep is poor, when inflammation is high, when your meals do not give your body enough building material, your skin can show it. It may look dull. It may feel dry. It may seem thinner. It may lose some of the healthy bounce you remember. Some of this is normal. Skin changes with time. But the way your skin ages is influenced by what you do every day. Think of your skin support fibers like a woven basket. When the fibers are flexible and cared for, the basket keeps its shape. But if that basket is dried out, bent, heated, and stressed again and again, it loses some of its spring. Your skin has support fibers too. One of them is collagen. Collagen helps skin stay firm and resilient. You do not need to chase every collagen trend online. You need to understand the basics. Your skin needs water, protein, sleep, steadier blood sugar, protection from too much sun, and less internal wear and tear. That internal wear and tear has a name: oxidative stress. It simply means cell stress from the pressure of daily life inside the body. Guava leaf tea may help here in a modest but useful way. It brings hydration, it brings plant compounds, and it can replace drinks that quietly work against your skin, like sweet tea, soda, or dessert-style coffee drinks. Will it erase wrinkles? No, that is not the promise. But can a steady, unsweetened herbal tea be part of a routine that supports healthier-looking skin over time? That is a much more honest and useful way to think about it. And here's the question I would ask you. Is your skin only changing because of age? Or is it also showing you how your body is being treated every day? That is not about vanity. That is about listening. Skin can be a messenger. Sometimes it tells you that you need more water. Sometimes it tells you that your sleep is poor. Sometimes it tells you that your blood sugar, stress, or inflammation may be showing on the outside. And sometimes the first step is not another cream. Sometimes, the first step is changing what you repeatedly put into your body. Now, before I show you the simple way to use guava leaf tea, I want to stop a mistake that ruins many natural health habits. People hear that something has been studied. Then they assume more is better. More cups, more herbs, more capsules, more mixtures. That is not wisdom. A cup of tea is not the same thing as a concentrated extract. An extract is a stronger preparation often used in supplements or research. Tea is gentler. That is one reason it can fit beautifully into daily life. But it also means you should not expect a cup of tea to act like a drug. The strength of tea is not force. The strength of tea is consistency, warmth, hydration, a gentle dose, and a habit you can repeat without turning your life upside down. So here is a simple way to make it. Use dried guava leaves from a clean, food-safe source. Place a small spoonful of the dried leaves into a cup. Pour hot water over them. Cover the cup while it steeps so the warmth stays in and the leaf has time to release its flavor. Let it sit until the water turns a light herbal color. Then strain it. Drink it plain if you like the taste. If the flavor feels too earthy, add a slice of lemon, a small piece of fresh ginger, a cinnamon stick, or a few mint leaves. But do not make it sweet. That is especially important if blood sugar is one of your concerns. If you are new to guava leaf tea, start with 1 cup. Not 3, not 5. 1. Choose one time of day. Keep everything else steady. This is how you learn whether a habit fits your body. If your main concern is after-meal tiredness, try it around the meal that usually makes you feel heavy. If your main concern is morning stiffness, use it as part of a slow morning routine. If your main concern is evening snacking, drink it after dinner to give your hands and mouth something warm that is not sugary. Which of those sounds most like you right now? The meal crash, the stiff morning, or the evening snack habit? Hold that answer, because it decides exactly how you'll run the next 2 weeks. Now, here is the 2-week test. This is simple, but it is powerful. For 2 weeks, drink 1 cup at the same time each day. Then track one body signal, not 10, 1. If you track too many things, you will confuse yourself. Choose the signal that matters most: morning stiffness, after-meal sleepiness, digestion, skin dryness, evening cravings, or blood sugar readings if you already monitor them. Write it down in plain words: mild, medium, or strong, better, same, or worse, steady, sleepy, or exhausted. You do not need a complicated chart. You need honesty. You are not trying to prove that guava leaf tea is a miracle. You are trying to learn whether your body responds to this small support. That is a grown-up way to use natural health. It respects science, it respects your body, and it keeps you from being pulled around by every new claim you hear. Tell me in the comments, if you tried this 2-week test, what would you track first? Your joints? Your skin? Your blood sugar? Your digestion? Or your energy after meals? Your answer may help another person realize they are not the only one noticing that same change. Now let's be realistic about what you may notice. Some people feel nothing dramatic. That is normal. Some people simply enjoy the warmth and drink less sugary tea. That alone can be a win. Some people notice they snack less at night. Some notice their digestion feels calmer. Some notice they feel less heavy after certain meals. For joints and skin, be more patient. Those are slower signals. Your body did not become stiff or dry in one day, so do not demand a one-day answer. Look for patterns. Look for small shifts. Look for whether the habit makes your routine better. And if it does not fit you, that is useful information too. Not every herb fits every person. Your body gets a vote. But before you cast that vote, there are 4 mistakes worth knowing, because they're the reason most people quit a habit before it ever gets the chance to work. The first mistake is sweetening the tea until it becomes dessert. If the goal is steadier blood sugar, adding sugar every time works against the goal. The second mistake is using leaves from an unknown or unsafe source. Use leaves meant for food use, clean, dried, and stored properly. The third mistake is mixing too many new things at once. If you start guava leaf tea, a new supplement, a new powder, and a new diet all in the same week, you will not know what helped or what bothered you. The fourth mistake is ignoring warning signs. If it upsets your stomach, makes you dizzy, or causes unusual symptoms, stop and pay attention. Your body's feedback matters more than any routine. This is why I like the 1-cup method. It is humble. It is practical. It keeps you safe. And it turns a health idea into something you can actually test. So let's close the loop. Why would guava leaf tea be connected to joints, skin, and blood sugar? Because your body is one system. Blood sugar affects energy and blood vessels. Large swings can add stress. Stress can feed inflammation. Inflammation can make joints feel more irritated. And the same internal strain can show up in your skin. So when you choose a warm, unsweetened tea with helpful plant compounds, you are not chasing 3 disconnected problems. You are supporting one body from several angles. Your body. And this is the part I want you to carry with you. The goal is not to believe in one perfect leaf. The goal is to stop treating aging as if nothing can be influenced anymore. Your body still listens. It listens to what you eat. It listens to what you drink. It listens to how you sleep. It listens to whether you move. It listens to the habits you repeat when no one is watching. And sometimes, aging better begins with something small enough that you will actually do it. 1 cup, 1 time of day, 1 signal to track, 1 honest look at how your body responds. That is not hype. That is intelligent self-care. So if guava leaf tea is safe for you, start simply. Use clean, dried leaves. Keep it unsweetened. Drink 1 cup at the same time each day. Track 1 body signal for 2 weeks. Then decide from your own experience. Not from fear, not from a trend. From your body. Before you go, write 1 word in the comments. Joints, skin, sugar, digestion, or energy. Choose the one you would track first. And if you have already tried guava leaf tea, tell us what you noticed. Your comment may be the exact thing another senior needed to hear today. If this helped you understand your body in a calmer, simpler way, subscribe to Senior Health Sessions. Share it with someone who likes natural health, but still wants common sense. And remember this, aging well is not built from one dramatic answer. It is built from small habits your body can trust.